Everyday care coordination is an approach that ensures multidisciplinary coordination of care and planning with inclusion of community and natural support. It is family focused, has authority over resources, and acts as an information hub between agencies and systems. The components of everyday care coordination include identification and engagement of patients and families needing care management, comprehensive assessment of the patient and family using screening tools to identify specific needs and goals, development of family, child, and youth-centered plans of care, which involves working with patients and families to develop and implement a plan of care, as well as the transition from pediatric care to adult care, implementation of the plan of care and referral follow-up, monitoring and evaluation, which is an ongoing process that involves assessing patient and family progress and addressing barriers to care, ongoing population-based surveillance for high-risk patients, such as communication, linguistic needs, demographic changes, and other issues that may arise. Everyday care coordination also facilitates a community-level service plan, focuses on understanding patient and family needs in the context of strengths, and connecting families and children with appropriate services, while ensuring multidisciplinary coordination and planning that includes community and natural supports and assesses placements regularly regardless of the specific service provider. As part of everyday care coordination, the file remains open if any member of the family is receiving services. Another important role that care coordinators serve is to follow up on referrals and to make referrals for community-based services as needed. While many physicians provide medical care for epilepsy, including primary care physicians and general neurologists, people with difficulty controlling seizures may benefit from working with a neurologist who specializes in epilepsy treatment. These doctors are called epileptologists. Other specialists you may refer to include pediatric neurologists, neurologists who specialize in the diagnosis and treatment of diseases or impaired function of the brain, spinal cord, peripheral nerves, muscles, autonomic nervous system, and blood vessels that relate to these structures. Clinical neurophysiologists, a subspecialty with psychiatric or neurological expertise in the diagnosis and management of central, peripheral, autonomic nervous system disorders using combined clinical evaluation and electrophysiologic testing. Neurologists with special qualifications in child neurology, providers who specialize in neurology with special skills in diagnosis and treatment of neurologic disorders of the neonatal period, infancy, early childhood, and adolescence. And surgical specialists working in neurological surgery, surgeons who provide operative and non-operative management, or in simple terms, brain survey. According to the National Association of Epilepsy Centers, patients should be referred from generalists to specialists if seizure control has not been achieved within 3 months. A referral to an epileptologist should follow if there is still no control in another 9 months. Referral to an epilepsy center should be based on the need for invasive diagnostic tests, inpatient psychiatric evaluation, difficult pharmacological challenges, possible psychogenic seizures, or evaluation for surgery. Primary care providers refer patients for many reasons, including initial diagnosis, unclear diagnosis, treatment initiation, treatment failure, side effects of treatment, long-term management, need for other services, insurance coverage or reimbursement, and patient preference. As you consider referrals and follow up as part of care coordination, it is important to remember not to simply refer patients, but to build relationships between providers based on their mutual commitment to address the needs of children and youth with epilepsy. Define clear roles and responsibilities for each of the providers and specialists involved. Establish processes and guidelines for communication and follow-up, and track and follow up all high-priority referrals and obtain results. Here's a quick overview of the signs it may be time to make a referral to a specialist. If seizure control has not been achieved within 3 months, if no control in another 9 months, refer to an epileptologist. If there is a need for invasive diagnostic tests, inpatient psychiatric evaluation, difficult pharmacologic challenges, possible psychogenic seizure, or evaluation for surgery.